can we tell if your baby's okay during labour? The second most dangerous thing any of us can do in our lifetimes is to get pregnant. Without hospitals, midwives, doctors and birth attendants, roughly 1/3 of women would die in childbirth. However, the most dangerous thing that any of us can ever do is to be born. Part of the reason for this is that the walls of the uterus start contracting. This, of course, is the room that the baby is called home for the last 9 months. The thing keeping the baby alive at this time is the placenta, which of course is nearing the end of its lifetime as well and is quite stressed. So therefore, we need to work out some reliable way to make sure that the baby is safe during labour, like they have on Krypton. For the time being on planet Earth, however, we're limited to CTG monitoring and measuring blood lactate levels from the baby. The CTG measures the heart rate of mum and bub, as well as the contractility of the uterus, and gives us an idea as to whether the baby's getting too stressed out or not. We look at the trace for reassuring features, like good variability or squiggliness on the trace, as well as transient rises in the baby's heart rate called accelerations. To get a more accurate read on the trace, sometimes we might need to put a little clip on the baby's head called a fetal scalp electrode. Sometimes it might also be necessary to take a little blood sample from the baby's head in order to measure the baby's lactate level. It's certainly not perfect, but we're working on things all the time to try and make it better. The problem is, if we set the sensitivity level or the threshold too high, we'll end up with babies who are born very, very sick or even worse. On the other hand, if we set it too low, we'll end up intervening with births that we probably didn't need to. That's where the experts looking after you and your baby come in. Trust in them and happy labouring.